So if you're dealing with some numbing or tingling down into the hands or anywhere along the upper limb here, we're going to go through some testing that you can do on your own. It is sometimes a little bit easier for a therapist to do it for you because of some of the positioning that we would normally like to see. But if that's not something accessible to you right now, this is still a good way to test which nerve might be affected. So sometimes if you're sitting, being at your desk, sometimes you might be into a bad posture, closing something off, and maybe you're getting some numbing or tingling or some carpal tunnel symptoms happening. Or if you tend to be a side sleeper and you are always waking up and that one side just feels like it's asleep, isn't waking up, it just kind of feels like a dead arm feeling. So that's what we're going to look at today, is the different nerves and how to test them just to help you out. So with this testing, if you feel any numbing or tingling sensations, any pins or needles down into the arms, or anything that feels more than just a stretch, that is what we would say is a positive test. Also, if you can't get into that testing position comfortably, that would also indicate that there is likely a positive test there with your nerve tension. So the first one, we're gonna stand nice and tall. You can do this seated as well, but with where you are gonna have your hand, might be a little hard if you have a chair with a back, or if you're seated in a chair, you might be running into it. So first one here, you're gonna come slightly away from the body, and then what you're gonna do, so I would start with the elbow bent here, and then you're gonna rotate that arm. We're getting some external rotation, and then you're gonna flex the wrist, and then you're gonna extend the arm. And then from here, I'm gonna tilt the head away. So this puts the full strain on that nerve. The nerve that we're going for here is your musculocutaneous nerve, your interosseous tissue, which goes between the two bones of the forearm here. And you're also going to be testing that axillary nerve just a little bit as well, which is right up and through here, so your pecs, stuff like that. And then the next one, what we're going to do, we're going to again start in that slightly bent position. You're going to slightly come away from the body. What we're going to do this time is we're going to internally rotate at the shoulder a bit, and then we're going to point so that we have the wrist down here. So you're pointing that palm towards the floor, and then you're going to flex the wrist forward, going with the thumb as well, and then you're going to slowly come into an extended position there, and then you're going to side tilt the head away on this one. Again, putting that full tension. What we're going to be mainly testing on this one would be your radial nerve. So the way I always think of which one is which between the thumb side and the ulnar side, the pinky finger side, is that thumbs are rad. So that is your radial nerve that you are testing. So might feel some sensation down in through these two fingers right here. The third one here is for the median nerve. So we're gonna be in that slightly bent position. You're gonna raise the arm up into a slightly abducted position, so putting it away from the body. Then you're going to do a little bit of an external rotation here, and then you're going to turn at that wrist going this way, and then you're going to extend that arm out. And then from here, you're going to fully extend and then tilt the head into this direction. So this will test your median nerve. So essentially we're doing this test that we did initially, but it's up at this position. Okay, and then the last one here is for your ulnar nerve. So you might feel it in through these couple of fingers or along the inner part of the forearm here. So what you're gonna do, that slightly bent arm position, you're gonna come up to that 90 degrees, and then you're going to rotate. So you're bringing that pinky finger up towards the sky, and then you're gonna extend back, and then you're gonna come a little bit behind the body, if you will, and you're gonna get into this position. Now this one somewhat looks like you're gonna be on the beach having just a nice sunny day. And then we're gonna tilt that head away. So might be feeling it in through here. So one of the more common ones that tend to find with people who work at a desk a lot is that median nerve one. So that is very important to take note of. If that position is too aggravating for you, you can always do it laying down so long as you're able to still extend the wrist. Now we're going to talk about how you can help relieve some of that numbing or tingling sensation. So you're essentially going to get into that same test. So I'm just going to get into that testing position. And what you're going to do is you can start from one end or the other. If you're feeling it in the hand, I would start as far away possible. So you can start by moving ahead, nice and slow and controlled, doing about 10 of those. And then once you do 10 of those, you're going to do the same movement at the wrist, bringing it in and out. So what this will do is like a pulley at two ends. It'll help get that nerve to glide through that area a little easier. So give those a try and figure out which one works for you, and then try that flossing technique and then retest that nerve test immediately after and see if you feel a little bit better.